What is metabolic syndrome from Schizophrenia Antipsychotics? Imagine taking medication to help manage a mental health condition, but then facing new health challenges that affect your heart and overall well-being. That's what can happen with metabolic syndrome linked to certain schizophrenia treatments. When doctors prescribe second-generation antipsychotics, they are often choosing medications like clozapine or olanzapine because they work well for controlling psychosis. But these drugs can also cause side effects that impact physical health. Metabolic syndrome is a group of health problems that tend to occur together. It includes severe weight gain, high blood sugar levels that can lead to type 2 diabetes, abnormal cholesterol or fat levels, and increased risk of heart disease. For people with schizophrenia on second-generation antipsychotics, the chances of developing these issues are much higher than in the general population. These medications can cause rapid weight gain, especially around the belly, and interfere with how the body processes glucose and fats. This disruption can lead to insulin resistance, which means the body's cells don't respond properly to insulin. As a result, blood sugar levels rise, and fat begins to build up in the abdomen. This process is partly due to mitochondrial dysfunction, which is when the tiny energy-producing parts of cells called mitochondria don't work properly. These drugs can damage mitochondria, reducing energy production and making it harder for the body to manage glucose and fats effectively. The risk of metabolic syndrome varies but can be quite high. Studies show that up to 60% of people taking drugs like clozapine or olanzapine develop some form of metabolic disturbance. This is a big concern because it increases the chances of heart disease, stroke, and even reduces lifespan. Managing this risk involves regular checkups for weight, blood sugar, and cholesterol levels during treatment. Doctors might choose antipsychotics with lower metabolic risks when possible. Lifestyle changes such as healthier eating and more physical activity can also help reduce these side effects. In essence, metabolic syndrome from schizophrenia antipsychotics happens because of the side effects these drugs have on how the body handles fats and sugars. It's a balance between controlling mental health symptoms and protecting physical health, which is why careful monitoring and management are so important.